Frankie and Britt, mother and daughter inseparable, spent a lot of time together, actually worked in a family business together. March 2016, Brittany came down with a sore throat. She lied down, her mother got her over the counter medications and also got her some fluids, some juice to help her get better. Later that evening, her mother went to check on her and found her unresponsive. The mother called paramedics. When they came, Brittany did not have a pulse. They resuscitated her and airlifted her to a nearby hospital. Brittany was diagnosed with the flu or the influenza. By then, she went into sepsis and every organ in her body shut down. Her heart stopped twice. They tried to resuscitate her, but they would not. Eventually, she died, 20 years of age. Diagnosis, flu. December 2019, Kylie Roberts, a jovial 16-year-old high school student in Ohio, spent Christmas with her family, opening presents, having fun, full of life, as the family described her. Upon going home, she fell ill. She wasn't feeling well. She had body aches, and her father thought it was just a cold and she would get over it. She often was just a very healthy girl. Therefore, there was no reason for alarm. A couple of days later, her father ended up taking her to the hospital as Kylie was not getting any better. By then, she was already in respiratory failure. The culprit was the flu again. At the tender age of 16, on New Year's Eve, Kylie passed away. These are two young women full of life that died as a result of the flu. The flu, a lot of people don't know so much about it or end up dismissing it. But we have come to know over the years that through the seasons, there are a lot of lives that the flu ends up claiming. Just the flu season, according to the Center for Disease and Control and Prevention, the CDC, a report that they have given us for the year 2019-2020, there has been at least 4,800 deaths that have been claimed as a result of the flu. Yet, as Huffington Post and most newspapers note, there's a lot of rise in anxiety when it comes to coronavirus from China. It is deadly, but the CDC warns that even more deadly is the flu that is right outside our doorsteps. Therefore, what do we do as a community, as individuals, to fight the flu? What is the flu anyway? The most important thing is to be well educated and informed about what truly is the flu. What are the signs and symptoms? What are the diagnosis process? And what is the treatment? The flu is a respiratory disease. It is highly contagious. It affects the young and the old alike. In the beginning, we talked just the stories about young women with no previous medical problems, but the flu does attack the very young and the very old. What are the symptoms of the flu? The symptoms include headaches, fever, body aches, coughs, and sometimes coupled with nausea, vomiting. The very old usually don't display the symptoms of nausea and vomiting. That is mostly the young. But as we continue, as the disease progresses, the older patients might start displaying the symptoms such as nausea and vomiting. So how do we diagnose it? Most of the times when people end up at their doctor's offices, they're either really feeling horrible, dehydrated by then, running fevers. And when they do come in, after just noting the symptoms that the patients or the individuals are presenting, the doctors will order what is known as a rapid influenza test, and they usually will use these swabs, and they go through the one near, so one, they use one swab to the near, and they swab around the area and will put it in the little tube and send it to the lab to run it for a flu test. The flu test can come back either negative or positive. Of course, if it's a positive, that means the person does have the flu. However, it is important to note that some elderly people will test negative, but due to the symptoms that they're presenting, the physician will go ahead and treat them as having the flu because of the symptoms they are presenting, rather than going by the negative test. In a personal story, my son last year, he went through his wellness checkup before going to school. 4-year-old, going to pre-K. Previously, he was staying home with me. I did not give him the flu test because I thought I took care of him. He was not around sick people, so he was good. He went to school. I did not pay attention to the fact that he will be exposed to others that have the flu or their immune system is compromised. As I have said before, it affects not only the middle age or just those that have coexisting diseases. They do affect the young ones. My son ended up getting the flu. He was at home for 5 days, missing school. I had to take days off to take care of my son. I did feel horrible as a healthcare giver, not having provided that for my son. Why do I mention this story? Because the flu hits really close to me. When we did take him, they did do the swab test, and they found out he was positive for the flu. He was sent home. We were encouraged to give him a lot of fluids, and also he was ordered for what they call Tamiflu, an antiviral medication to fight the flu or to fight or help reduce the severity of the symptoms. This is a fortunate case. Other cases don't go too well. That is why it is important to know the risk factors, that not only the very sick are affected by the flu, but even normal, regular people and even the young, very young children. So let's talk about the risk factors for those that have a compromised immune system. For example, those that have AIDS, cancer, they run at risk because their immune system is already compromised. So when they come across people who have already the flu, they tend to contract that also quite easily. It is also important to note that those who are healthcare workers run at a risk because you end up meeting a lot of people that either have the flu or have compromised immune systems. So as a healthcare giver, we are required by the hospital to get immunization, which I will talk about shortly. It is also very important to note that to fight the flu, you have to be equipped by these truths. Number one, what it is just not a bug or a stomach flu. That is very different, or a cold is very different. For example, the symptoms of a cold, they might be similar to the flu, but they're usually gradual. And we see after they peak, the person tends to get better over time. But with the flu, it seems like they get worse, they get dehydrated, and the symptoms appear abruptly. But the doctors usually will run the flu test in order to determine for sure if a patient has that. The CDC also has recommended that we do get vaccinated. Why? Vaccination translates to a lot of things. It prevents at least 4.4 million illnesses. It prevents 58 flu-related hospitalization. It also prevents at least 3,500 deaths. This is one way we can help fight the flu. When we are equipped with the truth, there are people that are afraid to be vaccinated, like I thought my son doesn't need it, or some people are anti vaccines. We are here not to push but just to recommend. As the studies have shown, there is better outcomes for those who actually do get vaccinated. Information is important, education is vital. Other things that we can do to help prevent the flu other than vaccination, of course, is washing your hands. That's the number one defense that we have against any illness. It's our number one line of defense. During the flu season, which typically runs October to March, it's important to constantly keep washing your hands at home, out and about. If you're close to a sink, get somewhere, wash your hands. Teach, if you have children, teach them to wash their hands. Other thing you can do is carry with you a sanitizer always. We come into contact with people even at the stores that are, coughing or touching surfaces that we are also coming into contact with. Therefore, making sure that we wash our hands is very important. It's wonderful that grocery stores now have wipes that you can use to actually wipe your cart before you use it, because as people go on coughing, sneezing, having runny nose, those do tend to run over surfaces, and then when you put your hands on them and put them next to your any kind of mucous membranes, your face, your mouth, your nose, you end up contracting the virus. Therefore, which leads us to another important factor: always avoid touching your face and your mouth, because those are the areas that kind of do get into contact with the flu virus a lot. The other thing that we teach everybody, and we teach children at school and even when they come to the hospital, is to always cough on your elbow, not on your hands. So will be the right way to cough or sneeze to catch that cough, because again, when you come into contact with people, rarely will you get into contact with their elbow. So that is yet another way we can prevent the spread of the virus. Another way we can do that is also by avoiding crowded areas, also avoiding the sick. If your child is sick, don't send them to school. Otherwise, they'll end up spreading that virus to everyone, and those children take it to the other children take it to their homes, and so on and so forth, and therefore that flu virus gets to go from one home to another. So prevention is a very important key in fighting the flu. When we look at the flu, it not only affects our health, as we have seen in the cases of Kylie and also Brit, it can lead to death. It also translates to a lot of money due to hospitalization. They are information that has been given by CNBC, which reports that they are at least per day, hospitalization wise, cost at least $2,200 per patient per day due to hospitalization. That, when multiplied by a couple of days in the hospital, it becomes very expensive, especially for those that don't have insurance. But even with insurance, it's important to know it affects not only your money in your bank, but also affects your time at work, loss of wages. Because when one is sick, they tend to take time off. In the case of my son, he missed school, I missed work, I missed my wages. Sometimes you will max your days that you have if you have any sick days. Therefore, it is very important for us to take the issue of the flu very seriously. Prevention is key. As we continue, we will also see that a lot of complications have resulted as a result of the flu, especially with the elderly. when they are hospitalized with the flu, they end up going into either respiratory failure, as we have seen. Even the young can end up in respiratory failure, end up in the intensive care unit. That also affects and even disrupts life. In conclusion, 4,800 lives is a lot of lives to lose every year during the flu season. It is therefore important for all of us to work hard to prevent the flu by getting vaccinated, staying away from the sick, cleaning your hands as needed, using alcohol or using the wipes that they provide at the stores, and also using a sanitizer when needed. For health caregivers, a mask is also recommended if one does not get their flu shot. That also is an important factor. Get empowered, get knowledge. Fight the flu, save lives. It begins with you. Thank you.